Good afternoon, everyone, and welcome to the webinar. My name is Zeta Smith, and I'm the CEO of Sodexo Seniors, and very, very excited to be here today to talk about a very, very important subject, which is vaccinations. Obviously, with the pandemic that has gone on well over a year, and with the introductions of vaccines, it's extremely important that we get educated and get the facts about getting the vaccine. So with me today, I have two esteemed panelists, Dr. Mark Rupp and Dr. David Lindner. And so let me first introduce you to Dr. Mark Rupp. He is professor and chief of the Division of Infectious Diseases in the Department of Internal Medicine at the University of Nebraska Medical Center. He is the medical director of the Nebraska Medical Center Department of Infection Control and Epidemiology. Dr. Rupp, if you could share a little bit about yourself and really your personal journey through this pandemic over the last year.
Sure. Thank you very much, Zeta. It's a real pleasure and honor for me to be with the group this evening, and I hope that we have a lively interaction and chat about the COVID vaccine. As Zeta related, I'm a physician in infectious diseases. I'm here at the University of Nebraska. I've been in practice for about 30 years. And, unfortunately, I've had to become an expert on COVID-19. I certainly didn't expect that a few years ago if I looked at my career course. I'm hopeful that we can all work together and get this pandemic squashed down. And hopefully, if we all do the right thing, we're going to have a much better summer. So thank you again for having me on the webinar this evening.
Looking forward to it. Thank you, Dr. Rupp. I'd like to introduce you now to Dr. David Lindner, who is the current medical director of the COVID-19 Response for NCH. He also is the medical director of the ICUs and respiratory care, as well as teaching responsibilities for the internal medicine program with the Mayo Clinic. So Dr. Lindner, if you could share a little bit about yourself.
Good evening. I'm also honored to be here and look forward to a discussion in regarding COVID-19 and vaccination. It's been an interesting year, and we are now coming full circle. We came from the period of time when we had little to no idea of how to treat COVID-19. And those of us, particularly in the ICU, were thrust into treating a disease that we had very little knowledge. As Dr. Rupp said, we, of necessity, had to learn about a disease, and that was like drinking out of a fire hose. After that period of time, we are finally coming from the point in time where we are hopefully going from treating a disease to preventing a disease. That is the focus for tonight. My personal goal is to be able to say that I just don't want to see the people that we're talking to. I'm an ICU doctor and the keeper of ventilators and equipment and things, and the person that you just don't want to see in COVID-19.
Well, we do want to see you tonight, though, Dr. Lindner, but certainly not in your workplace. How about that? Yes, thank you. Thank you for the introduction to both of you. And as I opened up this webinar, this really is about getting the facts. And so as you all are online and have some questions, we have two esteemed panelists that are here to answer those questions today. Again, this is about taking away some of those myths or beliefs that are out there, or I heard, or I saw, and really speaking to the experts to get down to the answers. So that you can make an educated decision on getting the vaccine. So with that, I'll ask the gentlemen, are we ready for some questions?
Let's go.
Okay, we got some thumbs up. So Dr. Rupp, I'll start with you, and really a very basic question. Why should we get the vaccine?
Well, as Dr. Lindner related in his opening comments, we're at an exciting point where we actually can prevent this disease now. These vaccines are amazingly effective, 95% effective in preventing clinical illness, and very, very effective at preventing serious hospitalization or death. The real reasons that you want to get this vaccine are, I think, threefold. Number one, just self-preservation. You want to avoid being one of those people who get sick and come into the hospital and potentially die from this disease. Number two, there's a lot of people who don't get that sick. And I fully acknowledge that. There's a fair number of folks who have relatively self-limited disease. They don't need to come into the hospital. There's a lot of people who think, oh, this isn't all that bad. Unfortunately, those people can go on to transmit the disease to their loved ones, to their family, to their parents, to their grandparents. So the second reason to get the vaccine is to help your family and your loved ones. And number three, it's the right thing to do from a community standpoint, from a national standpoint, so that we can get this pandemic squashed down to the lowest level possible, get ourselves out of this hole that we're in, and start to get our lives back that we all crave so much. So do it for yourself, do it for your family, do it for your community.
Yeah, I like to think of it as it is bigger than just one of us. It's bigger than the individual. Dr. Lindner, is the vaccine safe? What side effects can we expect?
This vaccine's all the three of them that are available here in the United States, the two messenger RNA vaccines and then the Johnson & Johnson or JJ vaccine, have all been shown to be extremely safe. They have exceeded our estimates for how effective they are. I mean, we were ready at the beginning of this pandemic to approve a vaccine that was 60% effective. And instead, we have been able to have vaccines that came out in the 90 percentile range of effectiveness. And with that, the studies, these have not been, shortchanged. They've gone through vigorous and extensive work where people have gone through the normal pattern of looking at the vaccine, and they have been found to be safe. The percentage of people who are having severe reactions is very similar to that which we've had in vaccines throughout our history. People have heard about some of the other side effects, and those are mostly self-limited. Yes, we do expect that there's going to be a degree of people who have a fever and a degree of people who will have body aches. And we know that with one of the vaccines that there's the common big red spot that you're going to get on your arm, which can come up to about a week later with that. But these effects, for the most part, for the vast majority of people, are self-limited. Now, while there are some people who have medical problems, and if you do have underlying health conditions, you should then discuss those with your provider to make sure that there is not one of the problems that you cannot do that. Now, these are predominantly in the people who have had transplants, are in immunosuppressive agents. Those are the people who definitely need to talk to their provider. But in general, many of the people who have other diseases like diabetes and hypertension are overweight, some of the various risk factors for COVID, those are the people who definitely need to go out and get the vaccine, because these vaccines are effective, but have also been shown to be safe.
And Dr. Lindner, one of the questions that did just come in was, for those that have underlying diseases, and in particular diabetes, do they experience more severe symptoms with a vaccine?
We're not seeing necessarily more symptoms. And I've been involved in our vaccination efforts with in vaccinating probably 25 to 30,000 people here in Southwest Florida through our vaccine clinics. In all honesty, some of the people who have had more symptomatology have been some of the people who have the healthiest immune systems. They've had the most responsiveness to the vaccines. Again, most of those times were mostly self-limited and people who have the type of reactions that we expect. Similar to for many of the people when they have gotten the shingles shot, with that up in that vaccine, we know up to 50% of the people are going to have some type of a reaction. I'll be honest with you, we're not seeing those types of numbers with the COVID vaccine.
Okay, that's good news.
Zeta, if I could just add maybe
Please.
one or two comments to that.
Yes.
I completely agree that people with these underlying conditions that predispose to more severe COVID So as Dr. Lindner said, if you're a diabetic, if you're immunosuppressed, these are the patients that should be getting the vaccine preferentially because they're likely to have a more severe case of COVID-19. The only worry we have in some of those people is that the vaccine may not be quite as immunogenic, it may not be quite as effective, but it is certainly safe. And so again, I would not discourage people from getting the vaccine for concerns of safety. Again, we haven't studied large groups of immunosuppressed patients, for instance, to know how well it works. But we do know, after having given tens of millions of doses of this vaccine, that we're pretty sure of what the side effect profile looks like, and it is a safe vaccine.
And I think staying a little bit on that topic, is the vaccine effective, Dr. Rupp?
Yeah, it's highly effective. I mean, this is, to use a sports analogy, this is a home run. As Dr. Lindner related, that we, had anticipated when these vaccines were being developed that if they were 50 or 60% effective, we were going to be happy with that. Instead, they're 90 or 95% effective in large, well-controlled phase 3 studies looking at tens of thousands of patients in a randomized, placebo-controlled, double-blinded sort of fashion. So we're very, very sure that these studies showed the effectiveness of the vaccine. And then furthermore, after giving tens of millions of doses now throughout the country, we see their effect in real life, kind of real world settings. There's a number of publications now out from other countries besides the US, all showing that when we get this vaccine widely distributed, we really do see effectiveness and decreased rates of infection. It keeps people out of the hospital. It keeps people out of the graveyard. It really does work quite well.
Excellent.
And I think and chime in as well,
Please.
One of the most important things we see here is that this vaccine is definitely disease preventing. I mean, and that I think is the message that Dr. Rupp was just saying. And the data now appears to be signaling that it is probably, for the most part, infection preventing. And that's been one of the things. We're still messaging at this time, and people are wondering, well, why, if I get the vaccine, do I still need to wear a mask? Do I still need to practice appropriate, health prevention things in COVID? We have messaged for some time about wearing masks, about social distancing, and about hand hygiene. And those are still important because we are not 100% confident at this time that it is fully infection preventing. There could be the case of people still getting COVID and potentially spreading that. And so at this time, until we get widespread vaccination across our communities, we're still asking people to practice good health habits in preventing of COVID.
I would certainly agree with that. And I would also emphasize that, no vaccine, including these COVID-19 vaccines, are 100% effective. And so where they've been looked at very, very rigorously, they have an efficacy of approximately 95% in preventing clinical illness. But that does mean that a few percent of people who get vaccinated could still get ill. And that's why it's important for all of us to do the right thing. If we get everybody vaccinated, and we continue to use these non-pharmacologic interventions for a period of time, we'll get this pandemic under control. And then all of us can come out together feeling very safe, very confident that we're in a safe circumstance, and we can stop doing some of these precautions that everybody's getting so tired of.
Can we talk a little bit about the variants? So you're hearing a lot on the news, the mutation of the virus. Do you can you get sicker? It sounds like it's, much easier to transmissible. Dr. Rupp, any thoughts around the variants and the effectiveness of the vaccines?
Yeah, Zeta, this is really an important question right now. And what I would emphasize first off is that this is expected. Okay, so this virus does undergo mutational events. Over time, it will change its characteristics. And so that's what we're seeing. The more virus that's out there circulating in the world and in our communities, the more likely that these variants are going to emerge. Again, another really strong reason why all of us need to step forward, get the vaccine, get the amount of disease reduced to the lowest level possible, and then that will stop these variants from emerging and then spreading. We have several of these variants that have been described throughout the world. There's one that's known as the B117 that's out of UK. There's one out of South Africa that's got a number 1351. There's one that's called P1 out of Brazil. All of these variants that are from foreign countries, as well as the variants we're seeing in the United States, one that's been named the California variant and one that's the New York variant, all of these have characteristic mutations in what we call the spike protein. The spike protein is what enables the virus to dock with our epithelial cells, our respiratory tract, and then to cause disease. So when that spike protein mutates, it's able to bind more tightly or more easily to our cells, and then that results in a virus that's more easily transmissible from person to person. That's what we think is going on with these, that they're able to be transmitted more readily from person to person. There's also pretty good data to suggest that when people get these variants, that they may be more ill than they would be with one of the wild type variants. And then finally, something that's very, very concerning is that they seem to be a little bit less susceptible to some of the monoclonal antibody preparations that have been generated to treat patients with illness. And there's just a little bit of information to suggest that maybe the vaccine isn't quite as effective. Maybe the level of protection is not quite as high, but again, the level of protection that we get with the existing vaccines against the existing variants is still very good. And so again, another reason why we want to get people vaccinated so that we can get this thing down, prevent those variants from emerging, and hopefully prevent variants from emerging that are even more transmissible or more dangerous or able to escape the vaccine. Right now, we're not seeing any of those, but that's the concern.
Thank you, Dr. Rupp. Switching gears a little bit, and Dr. Lindner, you kind of alluded to it earlier about kind of the social distancing, the wearing of the mask. So if I've received both doses of the vaccine, do I still need to do that?
And that's an excellent question, and I think one that everyone is just aching to be out of these masks and not have to do social distancing and return life to normal. And what we're seeing is that right now, and I think that people have to realize, is that we're going from here to here. We're on a trip, and at this point in time, we haven't arrived yet. And I think that is probably one of the messages. We do know that masking has been effective, and that basically earlier in the discussion, Dr. Rupp alluded to the several of the reasons that we vaccinate ourselves and for our family and for our community. We do masking for basically the same reason. We mask to protect ourselves and we mask to protect others. And at this point in time, for the exact reasons that we already alluded to, while we know that the vaccines appear to be disease preventing, under those small percentage times when they could still get the infection and other people may not be vaccinated, we still, for now, do need to wear masks, socially distance, and practice good hygiene efforts in order to push down and keep down this pandemic. We do, however, have some changes. And that is that if I've been vaccinated and you've been vaccinated and we're in a small group, and with that, the masks now and the recommendations can come down in that setting where you know that the other person is already protected and you're protected. So we're seeing now that change, that place from here to here where we know that we can now do and see hopefully the light at the end of the tunnel where we no longer are going to have to do that. But for the time being, it's still important that we practice these good health habits and continue doing that for the same reasons that we've already talked about, to protect yourself, to protect others, and to protect our communities.
Thank you, Dr. Lindner. So I was watching the news this morning. There was a person who was very resistant to getting the vaccine. because he said, hey, I already had COVID, I didn't die. Why do I need the vaccine? So there's almost like a mentality of, well, I'm now immune because I already had it and I didn't get that sick. So what are the benefits, Dr. Rupp, of getting a vaccine even though you've already had it? And if you've had it, how long should you wait to get the vaccine? Any thoughts there?
Yeah, and that's another good question. So what we know about this is that when people get a native infection due to the SARS-CoV-2 or COVID-19, they do get an immunologic response, but sometimes that response can be kind of spotty. So some people get a brisk response, other people don't. We also know that there's some people whose protective immunity from the initial infection will wane over a relatively short period of time. So within 2 or 3 months, we know that there are some people who are no longer immune to it, despite the fact that they had a well-described confirmed infection. We think we can actually do a better job than Mother Nature with these vaccines. We think that the data shows that you get a brisker response, and then we're hopeful that you get a longer lasting memory response to the vaccines. All the data continues to point out that as we track people further and further down the road, that they continue to have protective effect from the vaccine. So even though you've had COVID-19, the recommendation is that you go ahead and get vaccinated. Now, if you're going to wait because you feel like you have natural immunity, the recommendations are you can go out for a couple, 3 months, but after that point, you are starting to get into the place where you can get reinfected, and those have clearly been described. And so to prevent that scenario, you should go ahead and get vaccinated. The official recommendation is that once you're over COVID-19 and the symptoms have cleared, you're okay to go ahead and get the vaccine. Again, if you want to wait 2 or 3 months, that's okay. But I would just recommend that, you consider getting the vaccine as soon as it's available to you. I just don't want to get into that situation where for some logistical barrier reason, a couple of months from now, you're not able to get the vaccine. You want to go ahead and take advantage of it and just get it as soon as it's available to you.
Get the vaccine. Dr. Lindner, are there any long-term effects from the vaccine that we're aware of today?
The studies that have been done at this point in time, and we're now getting out to 6 months and greater for our data, are not showing long-term effects. I'm going to say side effects from the vaccine. We are getting data to show long-term immunity and that the antibodies are still there, even 6 months out, which is, once again, extremely encouraging. We don't know yet whether we're going to need a booster or we may need additional vaccines down the road. But what we are seeing is that we're not seeing the problems that we were worried about. We're seeing some case reports and people are attributing this problem or that problem. But when you start looking in a rigorous fashion at the people who have been followed, in the studies, and we're talking 30 and 40,000 people studies, we're not seeing long-term side effects to these vaccines.
Excellent.
Zeta, the other thing that I would mention in that same regard is that, when we're giving vaccines to tens of millions of people, the things that normally occur to that population are going to continue to occur. So we're going to have numbers of people who have strokes, who have heart attacks, who get diagnosed with cancers, who get diagnosed with, their autoimmune disease, their multiple sclerosis, what have you. Those things are going to continue to occur after we've vaccinated people. And sometimes when they're in close proximity, people want to make that leap to say, oh, the vaccine has caused my stroke or my heart attack. And as Dr. Lindner said, when we look at the populations, that's just not being borne out. We're not seeing an increased incidence in those kinds of problems in people who've been vaccinated. And now that we're well over 100 million people vaccinated, we have a pretty good idea of what we're expecting. And we're not seeing signals for serious side effects.
And in addition to when you talk about the population of people who have gotten the vaccines, one of the other things, and I'm sure we're now going to ought to get into that, there were people who became pregnant during these studies. And that has been a concern for many individuals. Well, I might want to have a child, or I am pregnant, and we're not seeing problems with either the child or the mother in these studies. And there have been numerous individuals who became pregnant. They were instructed not to, but things happen. That's the natural pattern that we see. And the recommendations from the American College of Obstetricians and Maternal Fetal Medicine and the organizations that basically deal with pregnant women and neonatal children are recommending that you do go ahead and discuss this with your provider and with that, but that you can choose to be vaccinated even in those settings.
Yeah, there was actually just a study that came out within about the last week or so that looked at a group of women who had been vaccinated during pregnancy. They chose to get the vaccine and then to be studied. And they found fairly high levels of antibody in the umbilical cord blood at the time of delivery, showing that the fetus or the newborn was actually getting protective antibody from the vaccine that the mother had received. So this was, again, very encouraging information, is probably a reason why a woman would want to get vaccinated so that she could protect her newborn from this disease.
Yeah, one of the most common myths out there that you hear is, women in their reproductive years fearing that this vaccine is somehow going to negatively impact. So, Dr. Rupp, can you, I guess, talk a little bit more about the technical piece around how does the vaccine work that it would not interrupt, your reproductive system?
Yeah, this one is really unfortunate that it's just kind of taken a life of its own out there in the social media sphere. Like many of these myths, they do have a little kernel of truth to them, and that's where they start to take off. So the underpinning of this is that the spike protein on the virus has a small area of similarity to a protein that's found in human placentas. And so then from there, people extrapolated and said, oh, if you get vaccinated, you're going to form antibody to the spike protein, and then that's going to attack the placenta. There really is no evidence to suggest that that occurs. First off, this small area of homology or similarity between the two, the spike protein and the placenta, is extremely small, very, very minor, and there's no information to suggest that people form antibody that's going to cross-react with placenta. We're just not seeing any evidence to suggest that. In addition to that, if you carry that argument out to its logical conclusion, then if you get infected by COVID-19, you're going to have that same immunologic response. You're going to form the antibody to the spike protein, and that's going to attack the placenta. So you're not only going to have problems with sterility, you would also have all the problems associated with having COVID-19. So, it just makes absolutely no sense for folks to use that as the reason for not getting vaccinated. There's no data to suggest that you have problems with fertility. As we've already related, there's actually been women who became pregnant after vaccination during the studies. There's clearly lots of women who've become pregnant after we've vaccinated now tens of millions of folks. There is no evidence to suggest that there's any problem with a developing fetus or with a placenta. As Dr. Lindner related, many of the professional bodies are suggesting that the vaccine be made available to women who are pregnant. We haven't studied it in large groups of pregnant women, so we can't come forward with a recommendation to actually say people should get vaccinated, but there's no data to suggest that it's dangerous to a woman who's pregnant. There's no data to suggest that the vaccine will cause any future problems with sterility. And again, unfortunately, sometimes these these myths just take off and get expanded way beyond where they should go. People, kind of like to go in for these conspiracy theories, and I think that's an example of one.
Yeah, and that's exactly why we're having this webinar, right? To kind of speak to the facts. What are we hearing out there? And let's kind of talk about, the reality of it versus what's on social media. Dr. Lindner, one of the questions that came in is any allergic reactions. People are worried about allergic reactions to the vaccine. What might occur? There was a mention of, if I'm allergic to eggs, would I have a reaction to that? Can you share a little bit there?
Well, the easy one is the eggs, and that is that you do not have to worry about if you're allergic to eggs or egg protein, which is called lecithin, that you cannot take the vaccine. This comes from the fact that we have other vaccines that people take that are suspended in an egg lecithin protein. And so there were people who had problems with that. And even now, some of that has come into be suspect, and people who've had issues with eggs are even being able to take some of those vaccines. And so some of that has changed as well. But as to allergic reactions, we know that there are people who will have allergic reactions to vaccines. That again is something that we have seen for not only with the COVID-19 vaccines, but with all vaccines, including essentially all medications, that there are people who will have that. People who have been highly allergic, people who carry epinephrine pens that have to be take extra caution. And when the vaccines are administered, there is a period of time in which the person will be monitored immediately following the vaccine. The people who do have allergic reactions, and the data has shown that are going to predominantly do so in the first period of time, and then we're talking minutes, not hours, not days, but minutes of having this vaccine. And that is why the person who gets the vaccine is monitored to make sure that they're not having an allergic reaction. Having a temperature or aches or some of the other minor reactions that we see with vaccines are not allergic reactions. These are part of their body's response, but they are not, the type of allergic reactions that would prevent a person from getting the vaccine.
Zeta, if maybe I can add something to that as well. If you just look at the math, I think it's fairly reassuring to people. So the case fatality rate, if you were to contract COVID-19, we don't know exactly what it is, but it's probably somewhere around maybe 0.5%. So 1 out of every 200 people. The rate of anaphylactic reactions, serious allergic reactions to the COVID-19, the mRNA vaccines, is a few per million. So if you just look at the math and you say, okay, my chance of death if I get COVID-19 is 1 in 200 or maybe 1 in 400 versus a couple per million, it clearly tells you that your risk benefit favors getting vaccinated.
So speaking of vaccines, we know we have the flu vaccine, we have shingles, other vaccines. Dr. Rupp, can you share a little bit about the timing of those? If I get my shingles shot, can I get a COVID shot also? Is there a time in between I need to wait? What does that look like? And I know we're a little past flu season, but the same question applies.
Yeah, so, your biggest worry right now is trying to avoid illness with COVID-19. And so your priority should be to get vaccinated against COVID-19. You should put off other vaccines until you get your COVID-19 vaccine. The official recommendation is that you should wait at least 2 weeks between getting the COVID-19 vaccine and some other vaccine. So my strong recommendation to people would be get in line, get your COVID-19 vaccine, get that taken care of, And then a few weeks after that, then you can have that conversation with your provider of, hey, should I get the shingle shot, or should I get a tetanus booster, or whatever it is that you need to have. Luckily, we've had almost a non-existent flu season. And quite frankly, we're getting into the spring months now that will further combat the spread of those respiratory viruses, those routine respiratory viruses. So I'm not too worried about giving people flu vaccine this late in the season, particularly when we're just not seeing it circulating in the community. So I would tell people to put off their flu vaccine and make sure they get their COVID-19 vaccine.
Excellent. Dr. Lindner?
Well, in actuality, not only has this been a uniquely low flu season with that, but the first time in my 26 years in the ICU, I have not had one influenza patient in the ICU. And that goes about, again, why we're still doing our public health measures of masking, social distancing, and hand hygiene. That in alone should tell you that these measures work on what it's done to the flu shot. So I would totally agree with Dr. Rupp's statement. At this point in time, I don't think that worrying about having an influenza vaccine is appropriate. And I definitely wouldn't try to interrupt the cycle of getting my COVID shot in order to get another vaccine.
Understood. Dr. Lindner, there's a lot of concern around how quickly the vaccine was created. Seemed to have come overnight. It was quote a rush job. Corners have been cut. All of those that dialogue is out there. Can you share a little bit about kind of the evolution and how safe is the vaccine based off of the timing that people are referring to?
And that's an excellent question, and also something that I think is very important to understand. We need to deal with the fact that we have really two types of vaccines right now, and that the fact is we have the one which people do understand is a new technique that we are applying to vaccination, and that is the messenger RNA. And now, first of all, it's important to realize that this is not something that was just developed this year. Oh, by the way, we need to come up with a new manner of providing treatment for this disease, COVID-19. We've been working on this and working in detail since definitely 2010. They've already developed other usages for messenger RNA. There was a Zika vaccine that was developed, but then of course we controlled Zika without really needing to go to vaccination. The messenger RNA is essentially a technique by which we tell your body to make a protein. The key was that there was this fat lipid particle called PEG that was developed that coats the vaccine that allows it to get into your body. All vaccines have to get into the body for your body to have a response. And this development of that, we can see some people who have had a reaction to the PEG, but this is not new. This is something that we have been working on and has been developed. And then basically all we have to do, and messenger RNA means that we have a messenger that tells your body to do something. And that may ultimately be a silver lining of this entire COVID pandemic experience, where we may be able to have learned how to now even treat other diseases in a similar fashion. But that is what happens with the messenger RNA. Now, the Johnson & Johnson vaccine is a very traditional vaccine. And so that's something we've had experience for many years, where they take another virus, an adenovirus, which has been basically affected such that you can't get it. They then put the spike protein, and the adenovirus is what gets into your body. Remember, all vaccines have to get into your body so your body can then respond. What was the speed is that because the governments of our world, including the United States, realized we needed this and we needed this soon. And so you heard the terms warp speed and all of these things. That had most to be about the money and the basically support that was given by governments across the world to the vaccine manufacturers to be able to basically, smooth distribution, basically manufacture, provide the resources to do this. But the vaccines were studied in the normal manner, in placebo-controlled phase trials. Corners were not cut in that manner, nor were they cut by both the CDC, FDA, and other countries' regulatory boards in reviewing of the data to make sure that these vaccines were safe. So while we have brought them to fruition and now have authorization to use the vaccine in a very quick and expeditious manner, we have not cut corners in the manner in which they were developed.
Dr. Rupp, did you want to add anything?
Yeah, Zeta, I think that this just is a remarkable development, and it shows what can be accomplished when there's a unity of purpose. And so when, industry and government and medical science all come together, it's really amazing what can be accomplished. And I think the COVID-19 vaccine effort is a perfect example of that, where with everybody working together, we were able to accomplish great things. And as Dr. Lindner said, we cut the corners on the red tape, but we didn't cut the corners on doing the safety and the efficacy analysis. So we were able to get things out quickly. But, again, I think we have to be really transparent with this. And I think that people who are concerned about the speed of the development, I think we should acknowledge you're absolutely correct. It did happen quickly. In addition, we don't have years and years of experience with this vaccine. And that's why it's not fully FDA approved. It's got an emergency use authorization because we're in the middle of an emergency. And, the data is extremely supportive of its effectiveness and is, again, extremely supportive of its safety. And the longer we go with having given tens of millions of doses of the vaccine continues to be very reassuring that it's safe. And the longer we look out, the longer we find out how effective it is. And it just keeps getting better as time goes on. So again, I just want to reassure people that even though it happened quickly, all the data that we have to date suggests that it works and it works safely.
One of the other myths out there is that the vaccine will change your DNA or affect your DNA, and both of you are giggling. Maybe it's the messenger RNA. I don't know if it's the acronyms that can confuse. Dr. Lindner, did you want to first share, and then Dr. Rupp?
Be happy to. This is another one of those myths that, particularly on social media, has taken off. But unlike the myth we talked about before, essentially the messenger RNA basically cannot alter your DNA. That is just something it doesn't do. Essentially, messenger RNA is exactly what the term sounds with. It's a messenger. It tells your body to make a protein. It does not incorporate into your genetic structure and alter it. It can't do that. It's not DNA. This is a signal that tells your body to make a protein. And in this case, it's an antibody to the spike protein. And that is what it does. It is not something that alters. I mean, it's not going to, it doesn't create a snake out of a rabbit, so to speak. It basically just tells your body to make a protein. And in this case, it's a antibody. And those antibodies then basically are what prevent COVID-19 and the ability of the virus to attach to our cells. Thus, we don't get the disease.
Yeah, without getting too technical, the issue is that our cells guard our DNA in the nucleus. And when you get an mRNA vaccine, the mRNA cannot get into the nucleus of your cell. So it doesn't even come into proximity with your DNA. In addition to that, the vaccine doesn't carry any of the complex mechanisms that would be necessary in order to splice a piece of nucleic acid into your DNA. So it just doesn't have the enzymes, it doesn't have all the machinery that would be necessary for that to happen. So for those two reasons, it's just technically not going to occur. It's not going to get into your nucleus, and then if it did, which it doesn't, but if it did, it wouldn't be able to splice itself into the DNA.
We're getting the facts tonight. We're getting the facts. Dr. Rupp, one of the questions that just came in, with new variants fueling a surge in young people, how might that affect those who have been vaccinated already? Will a booster be needed to, should a booster need to be developed?
Well, the approach towards vaccination in our country, I think, has been rational, and that is that we've vaccinated the people who are at the greatest risk of having severe disease. So that, by and large, is our elderly. That means that younger people weren't eligible to get vaccinated up until very, very recently. And now most states are starting to move forward and announce that really anybody over the age of 16 can get the vaccine. But the vast majority of young adults in our country have not been vaccinated. And so they are at risk. And indeed, that's where we're seeing the new wave of cases is largely in younger people. So the age group of 20 to 29 and from 30 to 39 are the highest age groups right now for getting COVID-19. Unfortunately, some of this data is indicating that we're seeing and starting to see, and we have seen in other countries, more severe disease in those younger people. So again, it's a good reason why, even if you're young and healthy, you should go out and get vaccinated. The vaccines appear to be very effective, particularly against the most common variant, the B117 variant. So I think if you've been vaccinated, the data suggests that your vaccine is just as effective against that B117 variant as the wild type prior to this. So again, great reason to go get vaccinated, protect yourself from these variants, protect, if you're a young, healthy person, from getting the more severe disease that we're seeing with some of these variants. Again, all just reinforcement for why you'd want to go get vaccinated. Now, as far as the booster dose is concerned, we really don't know the answer to that question. Work is being done on developing boosters for these variants. Right now, it's not necessary, but it's certainly possible that a variant will emerge in the future that would require a tweak in the vaccine. We're not seeing that today, but it's possible. And we just don't know how long the immunity lasts. So again, we've got good solid data out 6 months or longer. I'm optimistic that we're going to measure the amount of immunity in years rather than in months. So I'm optimistic that it may be, something that you don't need a booster for a year or two, or maybe even longer. But we just don't have the data to say that. That's just my hunch. And we're going to just have to keep watching as we go into the future. But again, I'm hopeful that this isn't something like flu that you're going to have to get a yearly booster. I'm hopeful that it, will be much less frequent.
And I would agree with Dr. Rupp. When you especially look at some of the data on some of the other coronaviruses, you look at SARS, you look at some of the other similar types of things that there is evidence that some of this may last longer. But you have to remember to think like a virus for a moment. What does the virus want to do? It wants to survive. It wants to basically populate itself, and it is therefore going to, as we talked about, change. And we have seen changes with that. One of the good things about the messenger RNA vaccines is that basically, having done the first with that, the tweaks are relatively easier technically than some of the other vaccines. And so both Pfizer, BioNTech, and Moderna have already started working on whether or not they need to adjust their vaccine to several of the variants that occur. And that's going to be able to come out relatively quickly. And once again, that's not cutting corners. That's the ability to basically utilize the technology to basically flex with the virus, because the virus is going to flex.
So I'm going to speak for many of the grandparents out there who are already vaccinated, but haven't seen their grandchildren, or many in senior communities and getting visitors in. I think the question is for those that that are visiting, so children who haven't been vaccinated, I know they're testing to that. What should that interaction look like? You've been vaccinated, but kids have not. So Dr. Rupp, can I ask you first?
Yeah, again, the vaccines are highly effective. Go hug your grandchild. Truly, go enjoy that interaction. That's one of the reasons why people should get vaccinated. Now, we need to be a little bit judicious still. And so the, official recommendations are if you're fully vaccinated, and that means 2 weeks after you have received that last vaccine, you can regard yourself as fully protected. If you go into a small group setting with your grandchildren, with the family of your grandchildren, you can do that safely. Now, if you are all vaccinated, then, it's very, very safe. If you've been vaccinated, but obviously your grandkids have not, because we just haven't done the studies to get kids vaccinated yet, it's still regarded as a very safe interaction. If they, are asymptomatic, if that family that you're interacting with is asymptomatic, hasn't had a high risk exposure, I would say go and get that hug that you've been craving from your grandchild. That's the reason you get vaccinated.
Mm-hmm. And on the other hand, if the kids are sick, you have to remember that, we're still seeing adenovirus and all of the other viruses that children have. And if you're at risk for having one of those others, there are other viruses out there other than COVID. And children are the common, I guess I'll use the word, vector for producing those viruses. And so I think that the key here is if you're vaccinated and the kids are not manifesting signs and symptoms of illness, absolutely hug them because they need it. So do you.
Excellent.
Zeta, the other thing that I would relate is that the study is moving forward fairly quickly, looking at vaccination in children. And so, currently for the Pfizer vaccine, it's indicated for those 16 and up. For the Moderna vaccine, it's 18 years and up. Pfizer recently announced some data to suggest that the efficacy is very clear in kids from 12 to 16, and they're doing studies now all the way down to 6 months. So I think this is going to be something that evolves fairly quickly, and in the very relatively near future, we'll be seeing recommendations that the vaccine is indicated in our kids as well. That's going to be a big move forward, because even though kids don't typically get severe disease, sometimes they do, but usually they don't, but they can transmit the virus. And so they're part of this equation as to how we get ourselves out of this pandemic. I suspect that in relatively near future, we'll see the indications broadening, and then our children can take advantage of the vaccine as well.
Do you think that will be this year, Dr. Rupp?
I definitely think it'll be this calendar year. Absolutely.
Okay. I have a young son, so I'm just asking personally. So I think as we wrap up, would love for each of you to give kind of final thoughts to the audience. These are people who are joining that are seeking more information, trying to get more facts to feel comfortable, maybe hesitant for whatever reason, whatever they've read, etc. So Dr. Rupp, can I ask you to go first?
Yeah, I'd be happy to. And Zeta, thank you so much again for having me on the program this evening. I appreciate the opportunity to interact with your employees and their families and everybody else who will be watching this. What I would relate is that, this vaccine hesitancy is unfortunate, but I completely understand it. I think that folks don't need to look very long or very hard to see examples of government overreach and scientific misconduct and authorities acting badly. And this has been particularly true amongst our minority populations. So I understand the hesitancy to take the vaccine and the hesitancy just to trust folks. The unfortunate thing is that the data is clear and does show that the vaccine is effective, and everything we know about it thus far suggests that it's safe. And the one thing I just want to try to avoid is the fear of the past bad behavior, the hesitancy due to that, cause us to make another mistake. And then another mistake right now would be to not get vaccinated, to not protect yourself and your family, and to help us get this pandemic under control. So I think that, I would encourage people, get out there, don't just listen to me, but go look at the data. It's been very transparent. You can find it on the web at trusted sites. So the CDC, the WHO, the FDA, all have been doing a good job in getting that information out there in a transparent way. Take a look at it. I encourage people to be skeptical. I'm a skeptic. But in this case, the data is clear. Getting the vaccine is a good deal for you. It protects you against this disease that can cause acute illness, and all too often now the lingering effects, the long haul syndrome that we're seeing from COVID-19. You want to protect yourself from both of those things, the acute bad disease as well as the lingering symptoms that can go on for months. We don't know how long, maybe permanently. Protect yourself, protect your family, help your community, get the vaccine. Let's get this pandemic in the rearview mirror.
Thank you, Dr. Rupp. Dr. Lindner?
Well, I too also want to echo Dr. Rupp's words. That has truly been a privilege to have the opportunity to discuss this with everyone here. I think what I would like to convey as we wrap this up is the concept that vaccination is truly, I'm going to use the word normative behavior with that. For most of us, and I know for some that they may say, well, I'm a skeptic, I don't take this. But we have to remember, and for people who've had the either opportunity to live, work, or be overseas in places where vaccination is not, that diseases such as tetanus and diseases such as polio, and some of these things that basically were truly scourges, and in some places still are, of people, have essentially been eradicated through vaccination. Things that we used to, and I know that there are people, and I've read and interacted with some of our elderly population who remembered when they were fearful that their child was going to get polio. And yet now that is something that they don't have to worry about their child dying. And so vaccination truly has been, for much of our world and society, the normative action that we do, as opposed to it's not the unusual. And so I would like people to just, remember what vaccination has brought us. And yes, while there have been problems in our past, we have been tried to be transparent and open about how this process has come about how efficacious and effective that the vaccines are, and what the side effects and risks that can come about that people have to deal with. And then we want people to, to speak to their provider and their doctor and ask questions, seek their own information, and then hopefully be able to make an informed choice.
Thank you. Thank you, Dr. Lindner. Thank you, Dr. Rupp, for being so gracious with your time this week to share with the audience your level of expertise. And thank you for fighting the front line of this pandemic. I could only imagine the traumatic stories and the triumphant stories over this last year, but what a year it has been. Again, the purpose of this webinar was to invite anyone and everyone to get educated, to get the facts. I will share a website for all of you to go on that could provide a bit more of those facts, is www.us.sodexo.com/get-the-facts. So there's a host of materials and resources there that once again can help you educate yourself around the vaccines. But we had two wonderful guests tonight to share their level of expertise, and my thank you again for your time. Thank you to all of the audience for your level of participation and engagement, and we will be talking to you soon.